The average time to see a doctor in the United States is nearly 1 month. To see a specialist, it can be even longer. Not a surprise to many who have to carefully schedule their lives around that appointment. Here with more information on changes to the way medicine is practiced is Emily Ware, administrator for the MUSC Center for Telehealth. I've used it myself. Great to have you here to talk about it, because I think a lot of people find that, well, how does a virtual appointment replace being there physically? So maybe you could dispel that myth.
Sure, yeah, I mean, I don't know that we ever intend to replace fully in-person care. There certainly are areas along the healthcare continuum where you need to be seen in person, get a physical exam, certainly surgical procedures, et cetera. But there's so much that we can do virtually.
How is telehealth used?
In a lot of ways, more ways than I think people understand. A good amount of the ambulatory visits, so doctor's visits with primary care, specialty care, that you typically go into a brick and mortar facility to have your visit, can be done virtually.
Yeah, because you think you've got to get labs done, you've got to get medication prescribed, so
again, sort of it's about the continuum, the pre-visit experience. We make sure that the patient is scheduled and, for the virtual visit, and that they have what they need for the technology component, certainly whether it's a smartphone or a laptop. And then in the post-visit experience, I think it's important, you mentioned labs, any labs, imaging, follow-up items, we make sure that those are done, even though you're not in a brick and mortar clinic for your visit, that we get those follow-up elements done in person as they're required. Yeah.
So if someone is making a telehealth appointment with a doctor, and oftentimes these are not necessarily the doctors that they are more or less assigned to, their family physician. So how do you get assigned to a doctor and build that trust?
So we do scheduling through MUSC. We'll do scheduling for virtual visits or in person using the typical scheduling sort of mechanisms. But we also have a way to schedule yourself online. With or without a referral, you can come in through our Get Care Now website and schedule for example, an endocrinology or rheumatology visit, just because you know that you need a rheumatologist, and perhaps the wait times for in-person are months.
Right.
And so just going through the website, you can schedule yourself generally within a couple of weeks.
So you're saying that you can schedule a telehealth appointment with your primary physician, or let's say you haven't really established one, you just get assigned somebody, but they don't necessarily have to even be in state.
That's right. The physicians don't necessarily have to be in state, certainly. Yeah, a patient has to be in state to be seen by somebody who has a South Carolina license. But yeah, it's very easy to schedule online. You can also use the typical scheduling mechanisms, and either, and you can still pick a physician online using our website based on sort of their profile and the type of physician that you want to see.
So how does a basic appointment go?
Well, it depends on the device that you have, but it's actually quite easy. We typically send a link over to you, and you click on the link and go through the pre-procedure sort of questions that your provider might want to know prior to getting into the visit, and then the provider will join and walk through everything they would walk through in person with you.
But how can they tell? I mean, you say, I've got a rash right here. I mean, they can see what it is. They know what they're looking at.
Yeah. It's actually pretty cool. Certainly, the smartphones and cameras on devices now are quite good. We also do have what we call hosted visits in brick and mortar clinics, where we have more specialized equipment, where there are what we call peripherals, where you can actually zoom in on a rash, or using a telepresenter in the clinic, a remote physician can see into ears.
Oh, wow, really?
Yeah.
Oh my goodness. Okay, so these are some of the things that I did not know that you could do with telehealth. Okay, so you can really kind of drill into someone physically and see them for all that they are, almost as if they were right there on the table.
In person, that's right. Yeah, I mean, and in some ways, the peripherals allow for better visualization of an eardrum, for example, than we can even see in person with some of the equipment that we have. It just sort of depends on what's needed for the visit, and a provider can decide if you need to be seen in person. They'll ask you to come in and perhaps use one of our hosted visits, but so much can be taken care of virtually, just through conversation and sort of symptom management, talking through what devices perhaps the patient has at home. If they have a blood pressure cuff, we can understand what their blood pressures have been, et cetera.
Yeah, because those are things that you can't do without some of the tools that you would normally have in a doctor's office. Well, and it sounds like you have to be, as the patient, descriptive of your symptoms, that you can't just rely solely on the doctor on the other end of the line. You got to make sure that you can articulate exactly what's wrong.
Certainly.
All right, well,
and that's true in person too. You got to tell your doctor what's going on.
Exactly.
Yeah.
All right. Well, Emily, thank you so much for sharing with us. We really appreciate your time. We're back after this.